One thing that we see, and that's something that, again, that I'm going to be exploring a lot more in my upcoming fellowship, is what we see in postmortem tissue a lot of the time is that there'll be patients that we take tissue from at postmortem that have lived their lives and have never had any kind of cognitive issues, by the time throughout their lifetime. So by the time that they died, they've never had any kind of cognitive issues, no kind of diagnosis of any kind of dementia. But when you look at their brain, they have really severe amyloid pathology. And so it's really understanding, okay, in these patients that have all this amyloid pathology and sometimes quite a bit of tau pathology as well, what's happening? Why are they so resilient to developing, the kind of cognitive issues that you see with patients that have similar levels of these protein buildup, but they have, severe dementia or severe Alzheimer's disease? And so again, I think one of the key kind of insights into that is, how do the microglia respond? So how are they different? And that's one of the avenues that I'll be targeting in my fellowship, is to really understand how microglia phenotypes and functions change in these patients that have more of a resilience to developing Alzheimer's disease, or are kind of much more early on. So that's the trouble that we don't know, is that in these patients, are they just very, very early on in their Alzheimer's disease or in their dementia kind of pathology, where they had no kind of outward clinical symptoms, or are they just resilient? And it's hard to know from postmortem, where they are in that journey. But what we do know is that they have this pathology without any symptoms. So either way, if they're resilient or very early on, we've got a different kind of tissue and a different kind of environment compared to Alzheimer's disease tissue. And so it's really understanding, what role the immune system or what role the cells play in these patients as well. And that will give us a really big insight into how microglia phenotypes and functions are different between patients.